Since the beginning of the pandemic, I have been fully committed to transparency and providing the public information as we have it. As part of that commitment, today, I wanted to tell you directly that Alberta Health Services has identified Alberta's first case of COVID-19 likely transmitted within a school. This is not unexpected and is not a cause for alarm. However, I know that many are anxious about school safety, and I felt it was important to share this information with you and to talk about what it means. The transmission was identified at Waverley School in Edmonton. To date, AHS has identified 2 cases that were infectious while in the school, one of whom seems to have been the source for the other. While it is always difficult to say with 100% certainty where transmission happens, given the facts in this situation, it seems to be a likely explanation. All parents, guardians, and students of this school have been notified by the school within the last few hours and will be receiving additional information from AHS this afternoon. Anyone potentially exposed has been or will be contacted and asked to self-isolate. As I have stressed with previous outbreaks, it is critical that we do not shame or stigmatize individuals with COVID-19 or their close contacts. COVID-19 is a reality for all of us. These students and staff and all their close contacts should be treated with support and understanding. As I mentioned yesterday, even with the cautious approach we have been taking, we expected that we would eventually see some examples of transmission in schools. AHS is investigating and will assess, in collaboration with the school, school authority, and Alberta Education, if any additional measures are needed at the school. At this point, there is no evidence to suggest that the school will need to transition to a different learning model or that other staff and students are at risk. To date, none of the students or staff that are cases that have been reported as having been infectious while in a school are, to my knowledge, or have been sick enough to require any kind of acute care treatment. So none that I know of have been in hospital or in ICU. And with respect to recoveries, I would have to go back and work with the team to get that precise number for you. But those that became ill starting in late August or early September who may have attended school while infectious would be considered to have recovered again within they wouldn't be infectious within 10 days of the start of their symptoms. So some of those certainly have recovered. And there are some individuals who had been asked to stay at home for 2 weeks where that 2 weeks has ended. And so some of those close contacts in classrooms are starting to go back into schools. Across the province, as of this morning, there have been 78 cases of COVID-19 who attended school while infectious. Currently, only 57 out of the 2,415 schools in the province have reported an infectious case that attended the school. To date, the episode I am speaking about today is the only time where it seems that transmission likely happened in the school. Managing transmission in schools is part of learning to live with COVID-19 and the reason we have aggressive public health measures in place. Identifying in-school transmission potential quickly and taking action is crucial to limiting the spread and keeping schools safe. This is, however, another reminder that COVID-19 is part of our new normal. As I've previously mentioned, the more cases we see in the community, the more likely we are to see COVID-19 in schools.